So today we're going to be discussing assessment of the temporomandibular joint, or the TMJ. So I'd like to walk you through that process from ruling out to resisted range of motion. So before we actually start evaluating the TMJ, we need to rule out the joints distal. Now there are no proximal joints to the TMJ, so essentially really we're just ruling out the neck. Okay, so what I'm going to get you to do, if you don't mind, is to bring your chin to your chest. Is there any pain with that? Can I apply a little bit of overpressure? Okay, so I'm going to add a little bit of overpressure. Any pain with that?
A little bit.
A little bit, but not in your jaw, right? Okay, so face back up again. So next thing we have to do is active range of motion. So we're going to be looking at all the movements that the jaw is capable of doing. So the first thing I'm going to ask you to do is just to open your mouth. Okay, so this would be depression. I'm going to get you to close. And this is the action of closing is called occlusion. The next thing I'm going to get you to do is to bring your bottom teeth over your top ones. So bring your jaw forward if you can. Good. And that would be protrusion. Retraction is just the ability to bring it backward into original position. The next thing I'm going to ask you to do is lateral deviation. So I'm going to have you shift your jaw over to one side and shift over to the other side. Okay, always being sure to ask your patient if they're experiencing pain with any of those movements. After we do active range of motion, I'd like to take some measurements. So occlusion, the act of closing the mouth. Obviously, the patient should be able to fully close their jaw, so this is a 0 millimeter movement. Depression is the act of opening your mouth. So Simone, I'm going to get you to open. This should occur, it should be about a 2 to 3 finger width movement. So if we take the measurements, what I want you to do is close your jaw again, smile, show me your teeth. Okay, so the goniometer actually has linear measurements, if you can see on this side, in centimeters. So this is really good because you can actually see through it. So show me your teeth. Bring your teeth on top of each other. So this would be a 0 position. So I'm going to get you to open your mouth all the way. And so what I'm going to do now is eyeball the distance between, wide as you can, between top teeth and bottom teeth. So this is about 3 centimeters or 30 millimeters. So she's pretty close to minimum normal, which would be 35 millimeters. The next thing we're going to actually measure is protrusion. So that's the ability for her jaw to slide forward. So in order to do that, I'm going to turn her sideways. Okay. Now, so go ahead, I'm going to get you to sort of bring your jaw forward like before. Show me your teeth again. A little more. Okay, so this is harder, lots of teeth. There we go. So you can see that her bottom teeth, lips up, show me your teeth. There you go. Her bottom teeth are just over her her top teeth. Now, McGee tells us that we should be able to do 7 millimeters of movement. I don't even really need to use my goniometer this way. Do that again for me. So bring the bottom teeth over the top, show me big teeth. If you can see here, not sure if you can see, but there's maybe a millimeter here of protrusion. Once I measure, this would be the way that you measure, lining up the bottom teeth and the top teeth on these, on the goniometer, so that you can actually see through and eyeball the measurement. Retraction is simply the ability for her to bring back her jaw. Okay, back to neutral. Now lateral deviation, I'm going to turn you back toward the camera again. Okay. So lateral deviation is her ability to go from right to left. So big teeth. So show me your teeth. Okay. So you can line up the bottom teeth with the top teeth, one on top of the other normally. Now I'm going to get you to bring your jaw to one side. So if you're using the lines of the teeth, so start again. from the middle. If you're using the lines of the teeth as a guide, so over to one side. So she's probably slid over, I can't quite see from this angle, but it looks like about 1 centimeter, maybe a little bit less. Come to the other way. Okay, so in this way, she's got a little bit less deviation to the right, probably a 1/2 centimeter to 3/4. Without me getting into the picture, I just wanted to give you the idea of how the goniometer lines up. McGee tells us that normal, minimum normal should be about 10 millimeters, which is 1 centimeter. So we're going to skip passive range of motion because it is not done in the jaw. We do not do it in the jaw. We're going to skip straight ahead to resisted range of motion. So there are only 3 movements that we pay attention to. That is occlusion, depression, and lateral deviation. So depression is the act of opening the mouth. So I'm going to get you to open your mouth just a little. And I'm going to add resistance in the opposite direction. So go ahead and meet my resistance. Push down, try to open your mouth. 5, 4, 3, 2, 1. Any pain? Strong and painless. Okay, so occlusion, she's going to be trying to close her mouth. So I'm going to get you to open a little bit, and I'm going to add pressure at the top of the chin. So I want you to try to close your mouth. 5, 4, 3, 2, 1. Any pain with that? Strong and painless. Okay, so lateral deviation, I'm going to get you to move your jaw this way. Okay, so a little bit, come out of this a bit. I'm going to add some pressure. Go ahead and try to move against me. 5, 4, 3, 2, 1. Any pain? Good, strong and painless. And I'm going to push the other way. So try to come this way with your jaw. Open up a bit. Open your mouth a bit. Now come this way. 5, 4, 3, 2, 1. Any pain? Strong and painless.